Hi, and welcome back. Thank you for your continued company on this journey. If you happen to be joining for the first time, this is Catching It Early. It is a very personal chronicle and step-by-step exploration into my own journey to discover whether or not I have a neurodegenerative illness such as Parkinson's disease or Lewy Body Dementia. I am making these videos as I learn new things or have new things to discuss with you, and I'm taking you along with me as I go through this process in real time. If you're in this family of people who are going through this process of trying to uncover just what is going on in your brain and in your body because you have either risk factors, symptoms, or have been told by a medical professional that you may have a neurodegenerative illness, welcome. I would definitely encourage you to pop back to the very first chapter of this journey just to get the orientation and introduction, and then feel free to look at the different episodes and select the ones that you think would be most relevant or interesting to you. I should add that what I'm going to talk about in the next couple of videos is the result of a lot of deep dive research that I've been doing, and I am not a medical doctor or an expert in any way. So the information I'm going to be sharing with you today and in the next video are really just a result of me at my keyboard on the internet or on YouTube trying to discern the best possible sources to get the best possible information so that I can make the best possible choices and decisions. I would encourage you to go and do your own independent research and do not rely exclusively on what you may hear in these videos. I'm not the oracle. I'm not the last word on any of this, but these are the pieces of information that I have found most informative and helpful for me personally at this point in my journey. Today, I'm going to talk about risk factors / early warning signs and the confusion that definitely comes along with that. If you're early in the process, as I am, and you're trying to figure out what's going on, it can be an infuriating and in some ways even demoralizing process because, first of all, it can be very difficult to get an appointment with a neurologist less than 3 months out. So what do I do with that time in the interim? So what I did is what I always do. I got on the computer and I started to do my research. I tend to be a very analytical person, sometimes to the extreme, not going to lie. So I packed more information into my brain than my brain was really prepared to handle, and it kind of sent me into a little bit of a whirlwind. When I was doing my research, I was looking into, so the doctor said my REM sleep behavior disorder points to that. What else can I find to support that hypothesis? And what I found were a bunch of articles that indicated that the current state of research is not necessarily that these symptoms, including the sleep disorder, are risk factors, meaning they are a separate condition or a separate manifestation of something that points to or puts me at a greater risk of developing one of these illnesses at some point in the future. Rather, these are in fact early warning signs that the disease is already in progress, although possibly in the very, very early stages. And by early, I mean the doctor was right in that it could be decades before the symptoms manifest to the point where they are diagnosable or would be considered problematic, would interrupt my day-to-day life, would send me on a whole new trajectory. That doesn't mean I don't already have it. So I've talked about that in a couple of the previous episodes, and I'm going to go into more detail today about what I'm talking about and how I've arrived at the personal position for me at this point that based on what I am reading, I don't currently believe that I am headed in the direction of Parkinson's disease, at least not initially. Rather, it looks much more likely that I am headed in the direction of a very specific form of dementia called Lewy Body Dementia, which is attached and associated with Parkinson's disease because both of them are caused by the same set of circumstances in the brain, which is specifically a depleted amount of dopamine, which is a necessary hormone to allow the neurotransmitters that control both cognition and movement to operate properly, and also the presence of a very specific protein called alpha synuclein that isn't shaped properly to fit into those neurotransmitters or receptors properly. So they tend to kind of get rejected and clumped together and just muck up the works and interfere with those neurons in your brain being able to send the proper messages. And then the depletion of dopamine also further reduces the ability of those messages to be carried to where they need to go in the body. Now, there are other forms of dementia that also involve certain proteins in the brain clumping up or not functioning properly or causing issues. But specifically, alpha synuclein is the protein that is associated with both Parkinson's and Lewy body dementia, which is markedly different from other dementias. I'm going to talk a lot more about that in the next video that I make, which is going to talk about diagnostics and testing and how to figure out what's going on. But today, we can call them risk factors, we can call them indicators, we can call them early warning signs. I'm going to go through what I've discovered makes the short list, so that if you are experiencing any of these things, or someone that you're caring for is experiencing any of these things, if you have not already consulted a doctor, specifically a neurologist, more specifically, a movement disorders specialist, that's a subspecialty in the field of neurology. And also, if you're dealing with dementia, there's another subspecialty called neuropsychology. So that's different than, getting on BetterHelp and looking up your best therapist in town. These are people specifically trained with dealing with the psychological implications of neurodegeneration. So those are specialties. You can check your insurance, you can check your local neighborhood, and you can look for these specialists, add them to your care team. And hopefully something here would help you not feel so at sea or so frustrated with having to wait 3 months to get in to see a neurologist. And I also would highly recommend second opinions. Right now, I have a neurologist who seems to be taking a genuine interest in what's going on with me. He's cooperating with the requests that I'm making for the diagnostics that I want. But at the same time, I happen to live in a city that has a Mayo Clinic. Why wouldn't I see if I can get an appointment there? And that's not an easy process, but my primary care doctor did explicitly say to me, Mayo is where you belong, or some other specialty clinic that has a research arm, since what we need to do is participate at this very early stage in the research that's going on. There's so much that's not known. There's so much that's still confusing. We're looking for answers, but you know what? We might also be the answer, because me knowing that this problem might not show up from a clinically relevant perspective in terms of making a formal diagnosis, it could be 20 years, but right now I'm experiencing things that are relevant from a research and study point of view. Those of us who are in that boat need to make ourselves available so that we can be the future for this field, and we can conquer this once and for all. That's what the Michael J. Fox Foundation is all about right now. And there are several other organizations that are conducting research and studies. When people are talking about Parkinson's disease, it can be difficult to get a diagnosis because, first of all, because of the things that are still unknown, but also because there are certain criteria that need to be met to meet the protocol in order for that diagnosis to be entered. And, I would imagine there's some politics involved in that, but at the same time, there's also ethics and integrity. And so in my case, I am confident to about 95% based on everything that I have read that I am in the process of developing one of these neurodegenerative illnesses. Positive. So I went for a sleep study. That was diagnostic number one. And I said at the time when I made the video about getting ready for that it didn't matter to me what the test result showed. I know that I have REM sleep behavior disorder because of the research that I did. I know that I do. And I also know that REM sleep behavior disorder only happens for one reason, and that is because of a neurodegenerative issue in the brain. And that is a separate thing that happens at a separate stage of sleep than other parasomnias. So that's all I need to know. As it happened, my sleep study did yield enough information for my neurologist to feel that it supported a REM sleep behavior disorder diagnosis. And that basically opened the door for him to agree to some other testing that I have requested. And I'm going to talk about that some more in the next video. But when I went home from that initial visit and did my research, I was looking at, well, he said Parkinson's. And as I was doing my Parkinson's research, in the absence of any motor symptoms, the symptoms that we normally associate with Parkinson's disease, the physical noticeable symptoms, I don't have any of those, but I did have a number of non-motor symptoms. And subsequently, as I was researching, I discovered that when non-motor symptoms are present for a year or more, which is the case with me, in some cases, some of these factors have been present for a decade. In that case, Parkinson's disease cannot be diagnosed because no motor symptoms are present. But it would be more likely that a dementia with Lewy bodies diagnosis could be made. However, there's a core group of symptoms associated with Parkinson's and a core group of symptoms associated with dementia with Lewy bodies. And then there are other factors, other indicators, and there's a lot of crossover there between them. So whichever diagnosis, this is going to be relevant. And the reason for that is because the presence of these alpha-synuclein proteins and the depletion of dopamine in the brain is going to have the same effect in other areas of your body, regardless of which one of those labels we're going to slap on this bad boy. So I'm saying a lot of words. I'm going to read from some notes here that I put together. So core factors that if you present with these, your doctor will likely diagnose you with Parkinson's disease. And then if you have like some of the other indicators, but you don't have, I think it's like two or more or all of these core factors, then they likely won't diagnose Parkinson's disease. They will diagnose something called Parkinsonism. And somebody with Lewy body dementia who never develops Parkinson's may have a motor symptom, but that's not the primary symptom, or it didn't show up in the first year of the manifestations of these. And so I can be diagnosed with Parkinsonism, but not Parkinson's disease. I also can't be diagnosed with Lewy body dementia unless I meet the criteria for two or more of the core symptoms, or one core symptom and a biomarker. So the diagnostics that I'll talk about next time, if one of those supports one of the core symptoms, that's also enough to meet the criteria to make a diagnosis. Let me make one thing clear. I am not in a hurry to get a diagnosis, especially because what I'm reading is that if you have a diagnosis of dementia with Lewy bodies, your life expectancy is somewhere between 5 to 8 years. So let's delay that as long as possible. However, I think that becomes a less relevant marker, a less relevant benchmark when you get an early diagnosis because you've been so aggressive, as I am being, to identify these things. So I don't think that pursuing the diagnosis magically, cuts my lifespan short. In any event, I keep kind of going down rabbit trails here. Stream of consciousness, raw and unfiltered, is what I've promised from the beginning. But Parkinsonism would be the presence of any symptoms that look like Parkinson's disease, but are not yet diagnosable as such. And this also goes for some of these secondary symptoms that cross over or share territory with dementia with Lewy bodies. But the core symptoms we're looking for a Parkinson's disease diagnosis would be tremors, most obviously, any kind of rhythmic shaking. It typically starts in the hands or fingers, can also occur in the jaw, in the foot, and are most likely to occur when your limb is at rest. Second core symptom would be slowed movement. That's also known as bradykinesia. And that is something that makes it difficult for you to perform simple tasks such as getting out of a chair or dressing yourself. It's a slowing down or having to think about it for a minute before actually executing something that would be a very simple movement. Muscle stiffness, if muscles feel tense, painful, or are contracted for a long period of time. That can make it difficult to move around. You might notice in a loved one kind of a stiffness in facial expressions. Poor balance and posture is the fourth one. So, a stooped posture that is developing recently. If somebody's had bad posture their entire lives, that's not what we're talking about here. Or if they're having balance issues or having falls, that's another core symptom. Speech changes would be number five. So if you or your loved one are uh, over time beginning to speak more softly, maybe to the point where it's difficult to be understood, or more quickly, or slurred, or hesitating before forming words. If your speech is flat or monotone and it wasn't previously, that is another risk factor. And writing changes. So if writing becomes difficult or your writing suddenly becomes much smaller, or you have difficulty with cramping, is another risk factor. So core symptoms. Other symptoms exist. I'm going to talk about some of mine and some of the others. This is not by any stretch an exhaustive list. It's crazy. So again, I'm going to encourage you to go ahead and do your own research. That group, if you saw yourself in that picture, you may be struggling with Parkinsonism, which can be caused by any number of things, or you could be a candidate for a Parkinson's disease diagnosis, which is a very specific thing caused by a very specific set of circumstances and carries its own trajectory and treatment plan going forward. Please do not diagnose yourself or jump to any conclusions. These are indicators that you should consult your doctor, and document. Go in with a list. Don't rely on your memory. Just say, these are the things I've been experiencing. This is how long. Documenting the onset of these symptoms will be clinically relevant. So think about it before you make your appointment. If you're thinking about doing that, write it all down, keep it in a little spreadsheet. If you're a computer person, put it in a journal or a notebook. If you're not, when did it begin? If you need to go back and consult your medical records, or if you need to guess, estimate it. More information is better than less. So, Lewy body dementia, non-motor symptoms, and these can be present with people who have Parkinson's as well. And again, the distinguishing factor is, did the motor symptoms appear first, and have they been present for a year or more? Or did the non-motor symptoms or cognitive symptoms show up first, and have they been present for a year or more? That seems to be the tipping point right now from a diagnostic perspective. One can develop, you can have both, and one can develop after the other. Or sometimes people with dementia don't develop Parkinson's symptoms ever, or until the very late stages of their illness, and vice versa. There may not be cognitive issues with a Parkinson's patient until much, much, maybe decades later on, and then they will begin to develop some of these problems. Why? Because the underlying cause is exactly the same: the lack of dopamine and the aggregation of these abnormal proteins, the alpha-synuclein. Okay, Lewy body dementia. Core symptoms, most notably cognitive changes, number one. And that means you're beginning to notice a difficulty with attention, planning, multitasking, problem solving, reasoning. Now, come on. Everybody struggles with that from time to time. Do not panic. We're talking about a noticeable, marked, ongoing, or progressive issue in this area. So if you can't remember where you left your phone or put your car keys, or if you're trying to work on your, taxes, and you just suddenly say, I just can't sit here anymore, these numbers aren't making any sense to me. This is not what we're talking about. If you are stressed over something or over committed and you're finding that, your brain is tired, that is not the same thing. We are looking at an ongoing and progressive cognitive change that will happen over time and will not be resolving itself. It's not intermittent. However, Speaking of intermittent, people with Lewy body dementia also could have very pronounced variations in cognition, in alertness, in their concentration, and even in wakefulness. Excessive daytime sleepiness is one of the hallmarks of Lewy body dementia, needing a lot of naps, feeling very sleepy during the day, even if it seems that you had a pretty good night's sleep, which may or may not be the case based on whether or not you have apnea or REM sleep behavior disorder. There might be interruptions to your sleep that you're not even aware of. But in any event, you're tired excessively during the day. So, variations. If you or your loved one is finding that you're like staring off into space for protracted periods of time, just kind of not being present and not being easily redirected back to the present, or if you are experiencing delusions, which is a persistent belief in something that is very obviously untrue, if you're extra agitated or irritable, or unfocused and having difficulty concentrating on things, and that is fine one day and not fine the next day, and then fine 1 hour and not fine the next hour. And this appears to be progressing and persistent. Those are important factors. Now we are talking about a reason to consult your medical professionals. Now, even though I'm saying motor symptoms are not present, there can still be some movement changes that you'll want to take a look at. So there might be a little tremor or some stiffness, or your gait may be changing. Parkinsonism symptoms may be present, which is an indicator that's, oh, this is Lewy body dementia as opposed to another form of dementia. And I'll talk about the other kinds of dementias in my next video. One of the hallmarks, and boy, am I looking forward to this. One of the hallmarks of Lewy body dementia are visual hallucinations. Up to 80% of people with Lewy body dementia are going to experience visual hallucinations, typically earlier in this progression of illness than later. And when I say hallucinations, we are talking about fully formed, very detailed hallucinations. And in many cases, the person who is experiencing them is aware that what they are seeing is a hallucination. I know that's not real, but I'm looking right at it. And very often these take the form of a person. It might be a person you know, it might be a person you don't know. Very often they take the form of animals or children. I heard one person in one of the Parkinson support groups saying that their dad was saying that he was seeing dogs in the trees, that kind of thing. Or very often somebody will say they saw a little child run through the room. There are people who will go and sit out on their back porch and have protracted conversations with someone who's not there, and will even acknowledge, I know that that's not a person, but I'm having a good time. And to this, I would say, if you're a caregiver for someone like that and they don't appear to be in distress, leave them alone. Consult a doctor, but this is not something you have to fix. This is not something you have to dispel or rescue someone from, unless they are experiencing fear or anxiety or distress, in which case you're going to want to gently redirect. But I'm not going to go down the what to do role too much further than that right now. But I diverged because it's the one thing that I'm on the lookout for constantly, because I'm an overanalyzer. I'm looking around all the time going, is that real? Is that real? I mean, it's not quite that bad, but I am on the lookout and I'm on high alert for the first time that I have an experience like that, because that to me will be a marker that there has been a progression of the illness. And I guess I've revealed myself to be someone who would rather know than not know. Sleep disorders, and this was what sent me on my journey to begin with, specifically REM sleep behavior disorder, excessive sleep or lack of sleep. And that is something that's been kind of a weirdness with me for most of my life. So, of course, one of my questions is, these things that develop because the disease has progressed, how many of these symptoms are relevant if they've been happening my whole life, or how many of those can be attributed to something else? So as a napper, that's a lifelong thing with me. And when I mentioned this to my neurologist, he raised an eye, he did one of those, raised an eyebrow and made a little face, didn't say anything. So I don't know what that actually means or if he even knows what it means. I don't know if the research is there yet, but I can tell you that for most of my professional life, I have been someone who would take 5 minutes to eat my lunch so that I could have 45 minutes to go to my car and take a nap at lunchtime in the middle of the day. Just getting toward lunchtime, I would get very, very sleepy. It would become the only thing that I could think about. Can I please leave my desk now so that I can go and have a nap? Now, that's not every day. There are other periods of time because I have another condition. I'm bipolar. If I'm kind of on the hypomanic swing, and I'm not full blown manic, but I've had periods of intense productivity, high productivity, where I will go for a week without needing a nap. And I will be up until 11 o'clock at night and I'm hyper focused and I'm work on whatever it is that has my attention at that given time. And I do great stuff during that time. And it tends to go, I can do like sprints, I can do bursts of intense energy and then need a great deal of recovery. I have no idea if that's clinically relevant, but I am a woman who likes her naps. Insomnia is something that I developed about a decade ago. And it was in response directly, I can make this connection without hesitation to a workplace trauma that yielded a formal PTSD diagnosis. And so for the last decade, I have attributed my insomnia to PTSD. And this may still be the case. And I've treated it based on that assumption. The treatment that I am choosing is still working. But what will happen is I will get tired naturally at bedtime. I will go to bed like a normal person. I will fall asleep quickly like a normal person. And maybe 30 minutes later, I will wake up like it is morning. I mean, I will wake up and be awake, which is completely different than waking up in the middle of the night for the restroom and doing my very best not to allow my consciousness to rise to a certain level. I want to get right back into bed and go right back into sleep. And more often than not, that is what happens. But there are these other occasions, and it usually happens about 30 minutes in, where my eyes open and it's like, yoo-hoo, morning. And I am up. I will lay there and say no. Sometimes I will say hell no. And I will turn around and I will try to find the most comfortable position and I will fluff my pillow and I will say, I'm not getting out of this bed. It's bedtime. Go to sleep. But my body says, yeah, you're not going to win this battle. And ultimately, after 45 minutes to an hour of trying very hard to get to sleep and being unsuccessful, I will end up getting up and watching the worst television I can think of to find. That usually takes a couple of hours before it bores me enough or allows me to get sleepy enough to go back to sleep. Is that a part of this? Is it PTSD? I don't know. I don't know. So I've been through the core symptoms. I'll outline them in the description box in the notes. Because I know I'm doing a lot of talking, so that you can see them in a happy little list. And if I'm up to it, when I get into post-production, I might put some text on the screen to make it easier for you to make some notes if you want to. Other symptoms that are kind of associated with both of these illnesses that I personally am experiencing, and not all symptoms, some of them are experiences that might be relevant as well. So I'm going to mention them secondarily in case you recognize them as well. And again, there are more that I'm not going to talk about. So please do some more research. And every time I did another search, I ended up finding another symptom that said, what? I got that one too. So top of my list is head injuries. I've had 3, and I think I've spoken about them, or at least one of them, in a previous video. They were all a long time ago. 1986 was the last one, so that was quite a while back. However, my research has yielded that people can develop dementia decades after a single head injury that happened so long ago. Daytime sleepiness, we just talked about. My mental health history. I received a diagnosis of major depression ages ago. Late 80s, probably. And then later on, the diagnosis was bipolar 2 with hypomania, meaning I don't have full-blown manic episodes. Very definitely depressive. And then some other behaviors that pointed to hypomania, some poor choice making, some risky behavior that is alarming in retrospect that I made it through those years. But I was very young then and figuring the world out in the worst possible way. Um, During that period of time, most of my 20s and a good part of my 30s, I was on a succession of mood stabilizing medication, depending on the medical care that I was receiving at that time. So, you name it, I probably was on it at one point or another for long periods of time. And some of those medications are now being shown to have some potential impact on future development of dementia, because what do? They impact brain chemistry and what is going on with neurodegenerative diseases. Your chemicals in your brain are not doing what they're supposed to do. It's kind of a no-brainer. So, enough said about that. Um, Here's one: seborrheic dermatitis. That is a condition that happens on the face, scalp, forehead when there's an excess of skin oils that causes a secretion that creates the conditions that are favorable for a certain yeast to manifest in that area of your face or head. And dementia with Lewy bodies affects the autonomic nervous system, which can lead to an overproduction of skin oils, which can create the conditions that can be favorable for seborrheic dermatitis to exist. Well, I was diagnosed with seborrheic dermatitis about a year ago and given a shampoo to use to help with that. Just a little bit of flakiness on my forehead and in my scalp. And I'm thinking, what in the world is that? I've never, if there's one thing I've been complimented on my entire life, it has been my skin. It's been perfect and clear forever. But around the same time that that developed, I also started getting some redness in my cheek area, and it looked like something sort of like acne, but not really. There were no heads on pimples or anything. It just looked kind of rashy and red. And I was like, I guess my skin is changing because I'm getting older. And the dermatologist said, oh no, that is an overproduction of oil in the glands, and that isn't going to go away. They were completely unrelated in her mind, but they showed up at the same time, and they both have to do with an overproduction of skin oils. So I'm lumping them together and saying both of those things are an indication that there's been an advancement of whatever it is that's going on there. Never in a million years would I have connected that to anything like these illnesses. So go figure. But if a light bulb went on for you, add it to your list. Um, Diminished senses, particularly diminished sense of smell. I did talk in another video about diminished senses. It's the second chapter and it's titled Diminished Sensory Perception, I believe. And specifically, the sense of smell is something I noticed way before COVID happened, years before COVID happened. And it kind of sneaks up on you slowly. You don't really notice that it's happening until one day you do, until there are enough times that somebody says, do you smell that? And you say no, that you realize that there might be an issue there. And only recently, as I've been paying attention, have I realized that that, of course, is connected to a sense of taste, and that has also been affected in me. And I'm noticing there are certain flavors that will come through loud and clear. And I wasn't paying attention because I love food. My husband and I are both foodies. We do a lot of great cooking. We eat in a lot of great restaurants, and I'm enjoying the experience of cooking and eating on a daily basis. And I kind of didn't notice that my sense of taste was diminishing, or at least I didn't notice it fully. And once I started paying attention, I said, yeah, I think this has been affected. I realized that it's been this way for quite some time. And that should have been a no-brainer for me because I know those two senses are linked very intimately from my background as an aromatherapist. I knew that, but I just didn't put it together. In any event, I'm noticing that lemon comes through beautifully. So I am now asking my husband to provide me with an endless supply of lemon flavored things. and finding myself gravitating toward anything lemon flavored because I want that sense, that sensory experience back. Cherry is another thing that comes through clearly. Most berry flavors will come through. Clove, um, anise, those kinds of deep, earthy uh, aromas will come through. I mentioned in my other video certain herbs uh, will come through, basil, but others like mint or rosemary will not. So, unless it's very strong or unless I crush it and eat it right away. So, there's definitely been a diminished experience there. And then REM sleep behavior disorder, which was the first thing that sent me on this journey, which right now seems to be kind of under control. I don't know if I mentioned this previously, but I want to mention one other thing. Since hallucinations are a part of this lovely journey, there is kind of a in between a sleep disorder and hallucinations. There's this middle ground, and there's a thing called a hypnagogic hallucination. And that happens. I might not have all these details correct. So, again, do your own research. I'm just giving you what I've got at this moment. It happens when you're either in the process of falling asleep or in the process of waking up out of sleep. So, you're not in REM sleep, but you're surfacing or submerging. And in that moment, you're dreaming, but you're not in REM sleep. And in that moment, your dreams will more than likely take place in the environment that you are currently in. So I have had one of these experiences. And so for me, since I'm in bed and dreaming, what I'm dreaming is that I'm in bed, sleeping, and I'm in the position that I am actually physically in, and I have opened my eyes, which I don't believe that I did, and I'm seeing exactly what I would see if I were awake in that position. And there is a figure, a person, a silhouetted, shrouded person standing at my bedside. And I know in that moment that I should have been absolutely terrified, right? But I wasn't. I opened my eyes and said, that doesn't belong there. And that person, I couldn't see any facial features. It was really just like a silhouette or a person with a big hooded cloak on. And it should have been much scarier than my response was. And that person was poking me in the side, poking my side in a gentle way, in a non-threatening way, almost in an exploratory way, but like it was intended to annoy, like a sibling would do if they're just trying to piss you off. And I was talking to my husband. I was saying, Craig, Craig, there's a person in the room. Do something. Don't you see the person in the room? He heard me calling his name, woke up, and I was so articulate, unlike the mumbly kind of speech that can happen when I'm in REM sleep. I was so convincing that he actually got up and got out of bed and looked for the person in the room. And I was telling him, run, run. And he woke me up out of this. And it was not difficult to do because I was pretty close to wakefulness in that state anyway. And when I woke up, I kind of immediately recognized that I had been dreaming. And I said, oh, gosh, it was a dream. And I'm sorry, but it seemed real, except that it bugged me that I wasn't more terrified. Like my words sounded like I was terrified, but I didn't feel frightened. When I described this to my neurologist, it made it into the clinical note that he made that it was a hypnagogic hallucination, and that he specifically noted that I reported a hypnagogic hallucination, but only one I feel, only one she feels, is what he wrote. So he found that to be clinically relevant, I imagine, because in order to make the diagnosis of dementia with Lewy body, I would have to have ongoing hallucinations. And I guess that would count if it were one of a handful, but in fact, it is just one. And I've only had that experience once. I don't know what's going to happen going forward. What I find a little bit comforting is that what I've been reading is that most people who are experiencing hallucinations because of Lewy body dementia are not agitated or frightened by them. So, okay, I'm worried that I'm going to be living in a state of fear and anxiety all the time when this thing progresses, but apparently not. Okay. I want to thank you for joining me again. I'm going to make another video today, so these probably will be posted pretty close to one another, where I'm going to talk about diagnostics and testing and how to take this group of symptoms that hopefully you've taken to your medical professionals so that you can discuss with them the best path forward. And in my opinion, because this is how I'm wired, don't wait for them to tell you what test you need. Ask for the ones that you think are going to be most relevant to you and have the discussion. In the meantime, I'm going to press pause for now, and I'm going to say thank you for joining me. I'm really glad you're here. It's helpful and therapeutic and comforting to me to think that I am sharing this journey with others and that others are benefiting from it. And I have had some feedback from some of you that are letting me know that you've gotten some value out of this. So, yay. There's a great deal of meaning and reassurance for me in that. Please come back for the next episode. Go back and watch some of the other ones. Stay with me. I like to feel you near. And I'm super grateful that you've come along. Really.